Ever had one of these on your eyes and immediately Googled how to pop a stye? Stop. This video is for you. I'm a dermatologist, and if you can't tell, I have a stye. I'm gonna go over what is a stye, how do you treat them, and I'm also gonna debunk some common myths around styes. Stay to the end, I'll even show you some things that look like styes, but aren't, including some skin cancers. But first, I need a favor. Please click the subscribe button, like this video, comment below, let me know what else you guys want to talk about next. So a stye is a painful bump that grows on your eyelid, either along the eyelid margin or underneath the eye. It is most commonly caused by a bacterial infection. When it's along your eyelash, it's usually a bacterial infection along the hair follicle, and when it's deep underneath your eye, like mine is, it's usually an infection of the oil glands underneath, and man, can they hurt. The medical term for stye is hordeolum, which is a great word you can use at a cocktail party. I don't recommend pointing at people's eyes and shouting out hordeolum, because it just sounds weird. Hordeolum. Styes are more common in patients with blepharitis, which is chronic inflammation of the eyelids. It's also more common in patients with rosacea, patients can actually have eyelid rosacea, and then also patients with diabetes. There may be an association with poor hygiene or inability to clean the area. The most common bacteria that causes styes is Staph aureus. The most common symptoms are going to be pain and swelling. If it's on the outside of your eyelash, you will also see a little pimple. If it's on the inside, like mine, you will see a little pimple on the inside as well. Thankfully, most of the time, styes will go away on their own. You can help coax them to go away by doing warm compresses. You can soak a towel in lukewarm water and hold it over your eyelid for 10 to 15 minutes, multiple times a day. It helps the oil glands dissolve a little bit and may coax the infection to go away a little faster, usually within 10 days. Cleaning the area with diluted baby shampoo or a commercially purchased lid scrub can also help. In resistant cases of styes, you may be prescribed topical antibiotics or even a course of oral antibiotics. In really severe cases, you may even need a little surgical intervention, like a little drainage of the stye. The important thing is you have to distinct a stye from a chalazion. Styes are acute onset, they're painful, and they usually have a little pus bump. Chalazion, on the other hand, are not painful and they persist for a longer period of time. Stye treatment usually is just doing at-home care. You can use warm compresses 10 to 15 minutes multiple times a day. You can also use diluted baby shampoo or a commercially purchased lid scrub to clean the area and reduce the bacterial load. Usually within 10 to 14 days, it will go away on its own. In resistant cases, you may need a course of topical antibiotics or even oral antibiotics, or in serious cases, you might even need a minor surgical intervention. Now let's pop some of these myths. Myth number one, you should pop a stye. No, absolutely not. That is just asking for trouble. You may increase the risk of infection spreading, even getting something called orbital cellulitis, which is bad. The second myth is that you need antibiotics immediately. Actually, no, most of the time these will go away on their own, and you just using antibiotics may increase the risk of antibacterial resistance. Next myth is styes are caused by dirty hands. Actually, no, it's usually blockage of the ducts. It's not actually your hands getting dirty, it's blockage of the duct. And the next myth, styes are contagious. No, that's conjunctivitis, either viral or bacterial conjunctivitis. That is contagious. Thankfully, styes are not. Okay, and the final myth I've heard is cold compresses can shrink styes. While cold can help reduce inflammation, it's not gonna help the stye go away faster. Usually warm compresses are what you want. When should you see a doctor? Well, if things don't resolve after 1 to 2 weeks, that is a sign you should go see a doctor. If you're having vision changes, if you're having fevers and chills, those are also some good reasons you should seek immediate medical evaluation. And then if it looks like a stye, if it feels like a hard bump, it may not be a stye, it may actually be a chalazion, or it could be something more serious. Sometimes patients have thought that they've had a stye or chalazion, and it actually turned out to be a skin cancer. You can get things like sebaceous carcinoma, Merkel cell carcinoma, even squamous cell and basal cell on your eyelids. So if it doesn't look like it's going away after a couple weeks, it's definitely a good sign for you to get it checked out. So yeah, even dermatologists can get a stye. Some will say maybe I caused it so I can make a video on it. Others would say I'm just taking advantage of good opportunity. Either way, I'm in pain, and I hope this helped you because it made me forget about the pain in my eye for a little bit. That's it. Have a good day. Bye. And please don't forget to subscribe.